Hi guys, it's Jody Habecker here talking about my paper, which is on the hypoglossal nerve upper airway stimulator for obstructive sleep apnea. Snooze fest for you guys, I know, but I need to know this because I'm a respiratory therapist that works in the sleep lab, and a lot of my patients are asking me about this device, and I know nothing about it, but now I do. Okay, so obstructive sleep apnea is when your airway closes when you're sleeping. So you snore, you gasp, you stop breathing. Okay, hard on your body. Creates a lot of health risks. Cardiovascular, diabetes can't be treated correctly. It contributes to obesity because you're just so tired and you don't want to do anything. Okay, so the only effective treatment right now for sleep apnea is CPAP. Okay, so CPAP is a device, a mask you wear. Okay, looks kind of like this. This is one of the many. Okay, wears like this. There's an air that goes in, it blows that air in, keeps that soft tissue in the back of your throat open. Okay, so you don't snore, you don't stop breathing, you don't have those obstructions anymore. Okay, so that's the only effective treatment as of now on the market. Okay, the problem is making people adhere to it. You have to adhere to it for it to work. You have to wear it. So people don't like to wear it. Okay, so they try to come up with some alternate devices like dentists are making mouth guards. Don't do it. Changes your bite and pulls your chin out so far it causes severe pain. Never saw it work either. You can have UPPP surgery where you take out your tonsils, your uvula, your adenoids, all that stuff to create space. Never saw that work either. And it's a terrible surgery when you're older. So anyway, that's just a few of them. They have a mandibular advancement procedure, a maxillomandibular advancement where you surgically pull your jaw forward. A lot of people die. Don't do that one either. Tracheostomy is the only cure. So you open up the cartilage here, you put a tube down when they're sleeping, they just totally bypass the upper airway so they don't have sleep apnea. People don't like that one either. That's like you got a hole in your throat. Bad news. Okay, so that brings us to the implantable hypoglossal nerve stimulation device that is a treatment for obstructive sleep apnea. Okay, so the brand name that they use is Inspire Upper Airway. So it implants like a pacemaker device, connects to your hypoglossal nerve, and then it stimulates that muscle to create space. Okay, now, does it work? We'll find out. But the implant procedure can cause, adverse surgical, like infections, redness. It can, paralyze nerves, that kind of thing. For indications of use, they want you to only have moderate sleep apnea. Okay, so that means that moderate sleep apnea is you stop breathing or have obstructions 15 to 30 times an hour. Okay, so if you choose these patients that have 15 to 30 times an hour stopping breathing, that's what they chose. Okay, and it can't be central sleep apnea. There's obstructive sleep apnea, central sleep apnea. Obstructive, it's your soft tissue. Central, your brain says, don't breathe. How do you fix that? You don't, trust me. You just go with it and try to make it better for the patient. Anyway, okay, so once they implanted this device, they did studies on 1 month. After you get the device implanted, they only let it heal for a month, then they start it after a month. So they did 1 month, 2 months, 3 months, 6, 9, and 12 months. Okay, the results of the study were positive. Okay, they took a 25 breathing events an hour. Okay, so they stopped breathing 4 times every 4 minutes. Okay, so they stopped breathing 25 times an hour. Okay, they improved that to 9 events an hour. Okay, now at Lancaster General Hospital, we treat people over 5. Okay, so they're decreasing their obstructive sleep apnea. They're just not getting rid of it. Does that make sense? So it's positive results. It just has room for innovation. Okay, so they did studies on adolescents with Down syndrome, which is exciting to me because Down syndrome, their tongue is huge for the anatomy of it, but also they have a very hard time adjusting and tolerating the CPAP, okay? And they just want to feel better. So they did this results with only 6 patients, 12 to 18 years old, high functioning. It did improve them, okay? 6 children, they had an AHI less than 10. So it did improve their sleep apnea moderate from 15 to 30 down to less than 10. So for patients that cannot tolerate it, it is positive, okay? So there is limitations of this hypoglossal nerve stimulator. Of course, you're not curing it, you're decreasing it. You know, you're just, CPAP still remains the choice treatment for obstructive sleep apnea. So I thought I'd be fun and determine what would be a fun innovation. I think that they should do that, but they also, once you implant that, they should put like a tissue-like stent in the back of their throat so that when you're sleeping, that stent stimulates and keeps the airway open. I think I'm going to be rich. Anyway, thank you guys. This is basically what I'm saying in my paper. Thank you for listening. I appreciate it, and I wish you all very well. Merry Christmas.